My name is Sarah Fox, and I've been in the Dodgeville area working at Upland Hills for about 9.5 years and employed with Upland Hills for just a couple of months. I'm married. My husband Ryan stayed home with the kids when they were little, and then now has a construction business and builds raised bed gardens and chicken coops for people and patio projects and things like that. We like to do a lot of outdoor activities, so we do camping and hiking and canoeing. We live on a lake here in town, so we like to spend a lot of time on the water, and we do have a dog, and we like to take him out for hikes and walks. And then during the winter we do like to downhill ski, so we'll usually spend a weekend or two doing some downhill skiing. We like to ice skate and snowshoe in the winter too. So my original influence, my mom is a nurse and she taught nursing for a lot of years, so I was interested in medicine and specifically being a doctor from a pretty young age. Like elementary school, I declared that I was going to be a pediatrician, so that's pretty close to what I'm doing right now. So it's been a long time that I've wanted to be a doctor. You know, knowing with my mom, she was a pediatric nurse and she did a lot of health fairs and a lot of teaching and things like that, and so I really enjoyed doing that sort of thing with her when I was growing up. I really like to focus on the whole person, and I really am very passionate about prevention for people, so I like to look at what can we do with lifestyle, stress management, nutrition, exercise. What are the things we can focus on with those things that people are doing kind of every day to help prevent disease down the road? So I really like to try to get at things before they become a problem. And then once people do have illnesses, I really try to focus on more patient-centered things that we can do. So, you know, a certain medication might not work for a person because of their schedule, or you know, things might not work out for them to do certain therapies. So what can we do to try to help them get better without having to, you know, follow a cookie cutter kind of approach? I love delivering babies. So, you know, being in a delivery room when a baby is born is a very magical experience. That's really that's the highlight definitely of my day. I love seeing young kids and see them, you know, if I deliver them as babies and then get to see them over time, that's really very rewarding. And then I also love seeing multiple generations of families. So I love seeing a grandma and you know, maybe her daughter might come in for something, and then a grandchild might come in for something, and knowing multiple generations in a small town like this is really great.